Health headlines, what you should know about a COVID variant that may cause a summer wave, why it causes razor blade throat, and what else a severe sore throat could be a sign of. Joining us this morning, Dr. Scott Roberts, Yale Medicine infectious diseases specialist and assistant professor at Yale School of Medicine. Doctor, thank you so much for being with us this morning. This latest COVID variant is called Nimbus, accounting for about a third of all COVID cases at this point. Do you anticipate a summer wave of this strain at this point?
We're likely to see an uptick in some form. My best prediction is a mild to moderate wave. And this is really because we're starting at a very low point. I haven't seen COVID numbers this low since really the beginning of the pandemic. The past few summers, we've had mild bumps that peak around August. So COVID does seem to hit us about twice a year. And in addition to this virus always mutating and giving us new variants, we're about 6 to 9 months away from prior vaccine and many prior infections from the winter, so immunity has waned as well.
Now, what's known as razor blade throat, a common symptom of this new variant, what are we talking about here? I'm sure that's a term that is very new to a lot of people. Frankly, it was new to me when I was reading about it this morning.
It certainly sounds scary, but ultimately this is an anecdotal description of what some patients are reporting. But there's no data to suggest this is different than the standard sore throat that people get with COVID. Sore throat, this is a classic symptom of COVID. It hits about 70% of all patients. So I'm suspecting it's just the standard sore throat with COVID infection.
Now, if somebody is out there and they're experiencing a very severe sore throat and it doesn't improve after a little bit of time, could it be anything else besides this COVID variant?
Many diseases could cause a sore throat. This includes other viruses such as flu, RSV, and even the common cold. It could include bacteria such as those that cause strep throat. And it could even be due to things that aren't infections at all, like allergies. But if it's been a week and it isn't going away, that's the point I really encourage people to seek out their doctor just to take a look and see what's going on.
And doctor, are we going to be dealing with these kind of COVID variants in the future just as a rule from now on?
Yeah, it is always mutating and always evolving. But this new variant, and like many of the last variants, they're still within that Omicron variant family. This isn't a new Greek letter here. So every virus produces new variants over time. And really what we're seeing is that as it slowly marches along and changes, sometimes our immunity can't keep up, and that's when we get an infection. So this is really the standard progression of most seasonal viruses. And ultimately, I'm not too concerned with this Nimbus variant so far.
All right, well, that's certainly good news. All right, doctor, we appreciate your time this morning. Have a great weekend.
Thank you.
All right.